Hey, it's Jessica DaMassa with WTF Health. I'm here at the Connected Health Conference, and joining me right now, I have Sabina Zach. She is the Vice President for Community Health at Northwell Health, and I have Phil Marshall. He is the co-founder and Chief Product Officer for Conversa Health. Welcome, you guys. Nice to talk to you.
Thank you. Welcome.
Thanks. So I understand that you guys have a really exciting pilot program that has gone into place at Northwell. So I'd like to ask you, Sabina, to talk a little bit about it. I understand you're integrating Conversa's chatbot technology in a really unique way. So tell me what you guys are up to and why you decided to go this route.
So I think, information and communication technology is, becoming a key aspect in, or playing a key role in healthcare delivery of information. So while we're enhancing the quality of care, we're allowing conversational chats, delivery of information to again, engage patients in conversations that are provider-driven, but also provide information that is accurate and actionable. So it allows patients to embed, internalize data so they can make better informed decisions and improve their clinical outcomes.
So where in the hospital have you decided to integrate this chatbot technology?
So we're right now actually went live at Conversa, with Conversa at the
Northwell Health Solutions.
Northwell Health Solutions department, looking at chronic disease management for discharged patients.
All right, so talk to me, Phil, a little bit about what you guys are doing.
So with Northwell, a few exciting projects. So Sabina mentioned Northwell Health Solutions, which is reaching out to Medicare patients after they get discharged from the hospital, which is really interesting if you think about some of the challenges there.
Yeah.
And then also now live with oncology. So supporting patients that are going through those very difficult and anxious moments as they're preparing for treatment, they're in treatment or they've gotten through treatment. And then also have a program live with their marketing department to do health risk assessments, and then we're now in the preparation stages for multiple other departments as well. And so we're very excited to have Northwell as a partner and a client, and we're post the pilot stage, which I know no, don't be sorry. It's something you hardly ever hear.
It's like death by pilot in healthcare, right? I just assumed it was a pilot.
You do not hear it very often, but you're going to hear it here first. We are post the pilot phase, so we're actually now deploying a little bit more sort of system-wide, department by department with Northwell.
Okay, so what are some of the things that you've been seeing, I guess, as a result of having this technology already implemented, integrated? What are some of the things that the patients are saying? And also on the provider side, what are the clinicians saying?
So I think this is more, the pilot that we've started is driven by the care managers for the health solution component of that. And I think it allows our care managers and social workers to engage with patients and collect better information in terms of their experience and being able to address some of the early key symptoms that can lead to adverse outcomes.
On the administrative side, is it helping kind of move along care pathways, like helping kind of speed things up as far as care delivery? Is it helping reduce administrative expense? I know a lot of people look to chatbot technology to help kind of do those things and offload some of the more mundane tasks so that, there is kind of more of a cost savings in that way, something that hits the bottom line, or it's a savings of time. Are you seeing any of that?
Well, I think it's important to realize that we're talking about clinically intelligent conversations that are extending clinical care. So these aren't just, want to make an appointment or I've got a concern about a new problem. This is, we know when you were in the hospital, we know what your problems are, your meds are, and we're going to ask this and say that at exact this time. And so, sort of with that in mind, what we've seen is the call center, the clinical call center, is now starting to reevaluate how they're applying their personnel and their resources because they know if people are involved in Northwell Health Chats, they actually don't need to call them because we are regularly checking in on them. And so it's been a little bit of a relief, and now they're able to sort of step back and look fresh at how they apply those resources.
What are your hopes, I think, I'd like to get from both of you for this technology that you've implemented and integrated? What are your hopes for the future with it? Like, where do you see this headed next?
So I think we really want to revolutionize the way we look at health literacy in terms of how we engage and interact with patients to improve the provider patient communications, engage patients into learning information, health information, how to access information at the comfort of their own home. So shifting the whole model from inside the walls of healthcare delivery and information, inside the walls to outside of the walls, and allowing patients to embed, internalize this information so they can make better informed decisions and again, improve their clinical outcomes. But we're really bridging that gap because we're allowing patients to create that trusting relationship with us and improve the brand loyalty for the healthcare institutions as well. But that does translate into just better outcomes, especially for the vulnerable populations who don't find information easily accessible. Sure. And it's complex, or information that is provided to those who don't speak English and have low literacy levels, where information on paper is sometimes difficult to understand, but they do have access to web and access to mobile digital technology. And so if we're able to deliver this information to them in an accessible way, we're able to make strides in terms of how patients do in disease management and in prevention.
And you were even saying about integrating illustrations into some of this stuff, right?
Right, absolutely. So one of the things that was important for us to do was to allow patients to actually learn how their body functions. How do we teach them anatomy, physiology, and pathophysiology in a way that is in a simplified version so they can understand how their body functions. And so we're including animation with voiceover as part of these conversational chats to allow patients to actually understand, how their body functions, where, what the anatomy of their body is, so they can understand the disease process a little bit better, and they can again follow and adhere to the treatment plan that providers are prescribing.
And then Phil, for you, I just want to ask, with this technology, I mean, what's ahead? What are you excited about moving forward with this? I mean, this is like a rapidly evolving area, and it's exciting that you guys have, such specific case studies in proof of what's going on and how it can be implemented in successful ways. So what are you excited about moving forward?
I'm excited about a lot of things, but I think the thing I'm most excited about is something that Sabina actually alluded to, and that is, we've only got so many resources in healthcare. We've got caring people, but they've got a limited amount of time available to them. And so with all of our primary care shortages, with access issues that we have, and with capacity constraints, my hope is that this allows folks like Sabina and the people at Northwell and other health systems to take the limited resources they have and scale it to meet the massive amount of needs that people have and meet people where they are, so that you overcome some of the health equity disparities, whether it's language, whether it's literacy or otherwise, and help everybody sort of come up to a level of understanding and self-management to where they're all doing better, and do that without having to expand a whole bunch of people and costs.
Yeah. That's the key, right? That is the key.
Yes, absolutely. And I think that's where we're leveraging technology, especially these conversational chats, because we're able to create patient-centered, personalized approach with integration into medical records and so forth. We're able to drive something that matters to you as a patient rather than what matters to me as a provider.
Fantastic. Well, thank you guys so much for sharing your experience working together. It's a really exciting partnership, and we look forward to hearing what happens.
Thank you.
Thanks so much. I'm Jessica DaMassa with WTF Health. Thanks so much for watching.